Tamara Ugolini here with Rebel News. And all across Canada, terminally ill patients are being denied access to life-saving organ transplants because of their COVID-19 vaccination status. You may have heard about this through our reporting at organsnotcoercion.com. That website was developed specifically to advocate on behalf of Alberta resident Sheila Annette Lewis, who was being denied a life-saving organ transplant because of her refusal to receive 2 novel COVID-19 jabs, despite complying with the other vaccination requirements of the program, like being completely re-injected with all of the standard childhood vaccines. But in one heart-wrenching instance in Ontario, a young father of 5 has died as a result of one hospital's denial of a transplant referral because he remained unvaccinated. Whatever happened to freedom of medical choice and bodily autonomy in Canada?
If you don't want to get vaccinated, that's your choice. But don't think you can get on a plane or a train beside vaccinated people.
And now is the time for people who are still resistant to getting vaccinated to realize that that choice, which has consequences on putting our kids at risk, which has consequences at having us risk more lockdowns because they haven't chosen to get vaccinated yet, that there will be consequences for those people in not being able to go to a gym or a restaurant, not being able to go to a movie theater, not being able to get on a train or a plane. I want to stand up for the choice of those who are there for their neighbors.
Well, here at Rebel News, we are now launching a revamped campaign at that same website, organsnotcoercion.com, where you can take immediate action with your provincial or territorial health minister, urging them to denounce coercive vaccine mandates and change legislative and/or regulatory frameworks that condone this discriminatory practice. As Canadians are required to pay into a socialized medical system through taxation, they should have timely and adequate medical care available to them when needed. Delegating who is or isn't referred for organ transplant based on their vaccination status is morally bankrupt and unethical. If you agree, sign our petition at organsnotcoercion.com and let your health minister know that medical apartheid is never okay. That website again is organsnotcoercion.com, where you can follow along on all of our reports on this subject. For Rebel News, I'm Tamara Ugolini. Stay tuned for our reports on this topic at organsnotcoercion.com. Don't forget to sign our petition and let your local health minister know that not giving fair and equal treatment to all organ transplant recipients is wrong. Get involved at organsnotcoercion.com.